So good evening and welcome to the third in our preconception series, Sex, Testing, and Other Pregnancy Concerns. Our speaker tonight is Barb Dane, otherwise known as Nurse Barb in the Valley, who is an RN, MS, and nurse practitioner. So before we kind of get started a little bit, one of the things we want to do is just make sure that you know what resources you have available. You can download your personal health assessment. You can also download the resource guide. Both of them are in your handouts, and we'll also be sure to send you a link afterwards in case you can't find it. Please take notes during tonight's webinar because we really know that this is meant to give you a lot of information and you go through your pregnancy journey. At this time, what I'd like to do is turn it over to Barb, who's going to go through what we've covered so far and what's on tonight's agenda. Barb.
Thanks so much, Sharon, and thank you all for attending. I'm Barb Dean. I'm a women's health nurse practitioner here in the heart of Silicon Valley, and I care for women who deliver their babies at El Camino Hospital. And I've been asked to share with you what I tell my patients when we talk about what they need to know when they're planning a pregnancy. And I'm hoping you've already downloaded the personal health assessment and the resource guide. And we're going to have plenty of time for questions at the end. Sharon's put together some amazing polls so we can really get to know you better, and it's super interactive. At the end of the webinar, we're going to send you an email with a link to our previous two webinars, and let me just tell you about them now. So webinar number 1, we talked about thinking about getting pregnant and envisioning your future as parents, how to improve communication as a couple, your medical and family history, all kinds of issues on vaccinations and travel. And that's really top of mind for a lot of people now because of measles. And we're going to cover that tonight. We're going to talk about we talked in the past about age and risks to the baby, about sleep, your mental health, and reducing stress. In our second webinar, we talked about nutrition and how to improve the chances of getting pregnant, men's health and their fertility concerns, when to see a fertility specialist, and lots of resources. So tonight's webinar, we're going to talk about sexual concerns, testing for genetic abnormalities, and does a woman's age really matter when it comes to the risks to the baby? We're going to talk a lot about carrier conditions and some of the new testing options maybe some of you have not heard about. We're also going to talk about what El Camino can offer to you as a family, to dads, moms, and extended families. So here's our first poll, and we'd really like to know, how soon would you like to become pregnant? Now, I know a lot of my patients say, I'd like to be pregnant yesterday, so that would be as soon as possible. Maybe within 1 to 3 months, within 6 months, within a year, or more than a year from now. So Sharon's going to get us started with that, and we'll see what you guys are saying. All right, I saw as soon as possible, about 33%.
Yes, that's exactly what we got. So let me share that again so you can see it. So it's 33% as soon as possible, 0% within 1 to 3 months, 17% within 6 months, none within a year, and 50% for more than a year. So it definitely looks like everybody is planning ahead.
I love that you guys are planning ahead. It's super, super important to do that. So
it kicked me out.
It looks like we're going to get you some nice slides up soon. Sometimes even here in the heart of Silicon Valley, we have some technical issues that come up. So the next issue is, let's talk about sex. I mean, after all, that is how most couples make a baby. But talking about sex is not easy for most couples. And when you add in the stress of trying to get pregnant, it can be even more challenging. In many, many cultures, talking about sexuality and sex is considered off limits, and it may be difficult for you and your partner to seek help. But because our sexuality and our relationships are so private and so personal, it's completely normal not to want to discuss this. And yet, if there are concerns, do speak to your healthcare provider about other resources, which might include couples therapists or sex therapists. So it's also normal and natural to wonder whether what you and your partner are experiencing sexually is a problem, and or what, if anything, can be done about it. It's also easy to compare your sexual relationship to what you hear from friends or from what you see on television, movies, or even in pornography. It's so normal to be super excited, ready for lots of sex the first 2 to 3 months, and then get tired and worn out by scheduled sex and trying to get pregnant. Really, it's okay if you've had this experience. The fact is, many couples have a few challenges when it comes to sexual intimacy because real relationships, not those on Facebook or Instagram or in the movies, are complicated. Most of us assume that everybody else has their sex lives completely figured out and that very few people have sexual issues, and yet it's just not true. Many couples have challenges when it comes to sex. So what is normal? And you've probably read reports about what the normal frequency of sex is in a relationship. Well, you may be surprised to learn that most people who complete those surveys, they actually lie. That's right, people lie on those sex surveys. Most people assume that 3 times a week is normal. So no matter what their personal experience is, they usually mark down that they're having sex 3 times a week because no one wants to feel inadequate, even in an anonymous survey. But when researchers ask people who have been in a relationship for more than 2 years, and they ask, when was the last time you had sex? Well, we then get a more accurate idea. And the average was once every 3 weeks. So if you're having sex 1 to 2 times a month, you're typical. Notice I didn't use the word normal because everyone has a different sex drive and there's a wide range of what is considered normal frequency. In addition, if you live and work in Silicon Valley, you may be tired. You may be having long commutes, and you may not have enough energy to be intimate with your partner 3 times a week. And it's also normal and natural for couples to disagree about the frequency of sex. In fact, 75%, that's 3 out of 4 couples, at some point in their relationship will disagree about how often they want to have sex. And that means that most couples are not on the same page. And many times, the woman is the one with the higher libido, not the man. So no matter what your experience is, you're normal. Well, what if sex is painful? If this is your situation and having sex is painful, I want to reassure you that many couples are very hesitant to have sex and they may avoid it altogether. If sex is painful for you, you are not alone. And if you've noticed vaginal itching, burning, or an odor, there may be an infection causing the pain, and you should see a healthcare provider. Sometimes pain with sex means that the woman is not quite ready for intercourse. She may need more time for foreplay, such as kissing and touching, to be more receptive and ready for intercourse. Sometimes just by changing your positions or using a lubricant can lead to more comfortable, pleasurable sex. You can use coconut oil or lubricants that are sold in pharmacies. It's best not, I want to reinforce this, not to use saliva, as that can interfere with the sperm's ability to fertilize the egg. Now, if you've already tried these things and there's still pain, do see a healthcare provider such as an OBGYN, nurse practitioner, or physician, or if there's pain with sex for men, do see a urologist. Don't let embarrassment prevent you from getting the assistance you need, because we can help you have sex without pain so that you can have fun while trying to get pregnant. So let's talk about lubricants. If sex is painful, then it's recommended that, again, you spend a lot more time with foreplay and consider using a lubricant. And you're not alone. It doesn't mean you don't like your partner. It doesn't mean you're not turned on. In fact, over 30% of couples need to have a lubricant to have comfortable sex. You can look for a water-based lubricant if you're trying to get pregnant. You want to avoid the glycerin lubricants because they can harm sperm. And these are the recommended lubricants if you're trying to get pregnant. There's Sliquids Oceanics, Astroglide TTC, that means trying to conceive. Pre-Seed works very well. Yes Baby and Conceive Plus. Now, for more on lubricants, you can visit the Nurse Barb YouTube channel and search for my video, which is called Slippery Subjects. Well, what if sex is impossible? And I have many patients who have a condition known as vaginismus. This causes what's called an involuntary, so it's not in the woman's control, an involuntary contraction of the vagina, which then closes so tightly that penetration and intercourse is impossible. If this is something you're concerned about, first, you are not alone, and do see an OBGYN provider who has experience helping women who have vaginismus, because this is a condition that can very easily be treated. You can go to El Camino's website and use the Find a Doctor portal to find a specialist. And recently, I worked with a couple who had been married for over 2 years, who had not been able to have intercourse ever because of vaginismus, and yet they wanted a baby, and so did their in-laws. So we provided instruction, education, and a treatment program that they could work on in the privacy of their own home. So we would follow up every few months on their progress, and within a few months, not only were they able to have intercourse, but it wasn't painful, they enjoyed it, and they got pregnant. So if you or someone you love has vaginismus or any sexual issue that's preventing you from becoming pregnant, please don't let embarrassment prevent you from seeking help. Well, we've talked about some pretty personal issues so far, so let's just keep talking about sex. So I titled this slide, Communication 101. Now, many couples find that unresolved anger can sneak into a bedroom and leave couples resentful and unable to communicate effectively toward their shared goal of getting pregnant. As you and your partner consider becoming parents together, the very best gift you can give your much anticipated and wanted child is a good relationship with each other. I mean, let's face it, for many of us, it's easier to have sex than to talk about it. And yet the secret is the most important sexual organ is actually between your ears. It's your brain. And here's a few tips that might help. First, acknowledge that talking about sex can be difficult, and talk about the fact that you both have the same goal. That is, you want to have a loving and respectful relationship, and you want to have a baby. Then try to voice your concerns with love, avoiding any blaming or shaming. Remember that sexuality and the stress of trying to conceive makes everyone feel super vulnerable. And it's important to try to listen without becoming defensive. You can find a lot more information about creating more emotional intimacy and improving your relationship now and after the baby arrives at thegottmaninstitute.com. So let's keep talking about sex. So we've talked about the fact that talking about sex can be difficult, and letting go of judgments or needing to be right or to get your way. The goal is to listen and try to understand one another. That's why we have 2 ears and 1 mouth, right? So we can listen twice as much as we talk. When you've listened to each other to gain a better understanding, then it's important to voice your concerns and requests. So I've written a script here that you might find helpful if you're having some difficulty in your sexual relationship and you know it's impacting your ability to become pregnant. So I don't know, how does this sound? honey, I know that talking about the sexual part of our relationship is a real sensitive topic, and yet I'm really concerned about what's happening when we make love. We both want to get pregnant, and I think it would be helpful for us to talk to a specialist. Now, what if you are in a same-sex relationship? So for women who are in relationships with other women, there are many issues you'll want to consider before you get started. Seeing an OBGYN or a reproductive specialist is a good place to start. They can help with the process of becoming informed about the various options for getting pregnant, including how to access sperm donors and how to increase your chances of becoming pregnant. You're going to want to talk a lot about who will be carrying the baby and start charting ovulation, and you can learn about that in our previous webinar. You want to start charting ovulation so you can time the inseminations, and there's a lot of new ways to do inseminations. So, Sharon, I think it's time for another poll.
It sure is. So we want to know, have you chosen an OBGYN healthcare provider yet? Let us know.
So your options are yes, no, or unsure. And
we have a pretty steady number of people voting. Let's give it about another 10 seconds. What do you think, Barb? At this point, what do you think the answer is going to be?
I think it's unsure. I think most people are unsure at this point.
Well, I'm going to close the poll and tell you, you were not correct. We actually have 40% said yes, 60% said no, and no one said unsure.
Wow, how about that? So if you haven't chosen an OBGYN provider, don't forget we have the Find the Doctor portal on the El Camino website. And you can find someone who speaks your language, someone who you fit with. And a lot of us who do prenatal care, we do get acquainted visits so you can see if there's a good match. Well, let's talk a lot about testing now. We're going to switch some gears and let's talk about tests to consider before you get pregnant. So one thing that comes up, and let's skip down to the third bullet point here, measles, because that's in the news right now. Measles is an infection that can cause spots to develop on a baby and very, very high fevers. And right now, because many children have not been vaccinated in the United States, there's an epidemic. But I want to reassure you, an infection with measles in pregnancy does not cause birth defects. However, if a woman becomes infected with measles during her pregnancy, she does have an increased risk of delivering her baby prematurely or even losing the pregnancy through a miscarriage. So if you're planning to get pregnant, it's a good idea to have some of these tests, including the measles titer, T-I-T-E-R, to find out if you're immune. You also may want to consider being tested for rubella. This is German measles, and an infection with rubella in pregnancy can cause very severe problems for a baby. Now, most women were vaccinated as children, so they and their babies are not at risk. However, some women are not immune, and they will need a vaccination at least 3 months or more before they try to become pregnant. German measles can cause a baby to have deafness. Also, chickenpox, this is also known as varicella. An infection with varicella or chickenpox can cause severe problems for a baby. Now, many women who have been vaccinated or they've had the infection, so they have immunity. But again, like rubella, if you do not have immunity, you'll want to be vaccinated 3 months or more before trying to become pregnant. Another thing to be tested for is tuberculosis. Tuberculosis is also known as TB, and this can cause life-threatening consequences for the mom, baby, and other family members. It's very important to be tested either before pregnancy or after, well, when you're pregnant. Now, TB is much more common in women who have recently arrived in the United States from elsewhere. It's a very serious infection of the lungs, but it can be treated. Your healthcare provider will very likely order a blood test for you, not a skin test. The blood test is known as quantiferon gold, and it's the most accurate test that we have. So what about family history? So this is a very good time for you and your partner to find out if there are any inherited conditions in the families that could affect not only the woman's health, her partner's health, or any of your children. So you'll want to ask your family members if there have been any children or adults in either family affected by cystic fibrosis, sickle cell anemia, Tay-Sachs, or any other condition like muscular atrophy. Have there been any serious issues that have caused an early death in an infant? Were there any babies born with birth defects, or were there any babies born who needed surgery right after birth? Finding out about family history can be very daunting, and many people feel very uncomfortable asking for this information. That's why the resource guide that we're providing includes information about how to obtain your family history. And if there are conditions about family history or inherited conditions, you can talk to a genetic counselor ahead of time because they can help interpret your family tree and tell you if genetic testing is a good idea for you. So speaking of family history, have you and or your partner already had genetic testing? So there's a couple of options here. Some people use the online services like 23andMe or Ancestry.com. Perhaps you have been tested because your healthcare provider recommended it. Maybe you haven't been tested yet. Maybe you're planning to, or maybe you're not quite sure and you don't know enough about it. So let's see, or maybe, yeah, maybe it's something else. And if it's something else, just put it in the chat box for us.
That's a great idea. I'm going to share the results now. We have 25% said my healthcare provider recommended it, and 75% said, no, I don't know enough about it.
Wow, so that's very surprising because I have so many patients who have gone to 23andMe. But this is good because if you do go in for a preconception visit, you can talk to the healthcare provider about being tested before you get pregnant. Well, what are we testing for? There's a couple of different things that we want to talk about now, and that is chromosomal conditions. Many women wonder if they should rush to have a baby before a certain age because of the added risks to a pregnancy from birth defects and chromosomal abnormalities. Now, the term chromosomal abnormality it's long and it's confusing. So let me explain what this means. When an egg and sperm get together, each parent contributes 1/2 of the baby's genetic DNA. So each parent contributes 23 chromosomes, and when they combine, the result is 23 pairs of chromosomes. That's what you see here. Except in our slide, you see that there's 3 chromosomes on number 21. This is a condition known as trisomy 21, which is also known as Down syndrome, and it's the most common chromosomal condition according to the March of Dimes, although it affects less than 1% of pregnancies. When parents are each contributing 1 copy of the chromosome so that there's a pair, once in a while, one of the parents will contribute 2 copies and the other parent contributes 1. That means that there's now 3 copies, like what you see in trisomy 21 here in our slide. This is known as a trisomy. These can cause various degrees of physical and mental problems. So trisomy 21 is the most common one, but there's also trisomy 13 and trisomy 18, and these are even more rare. Well, Sharon, we want to launch another poll because we want to keep this very interactive. Would you mind reading this one?
Sure, happy to. Do you have any concerns about how a woman's age might impact risks to the pregnancy? Let me launch the poll while I share the answers with, or share the The choices: yes, I've heard that after 35 there are more risks to the baby. Yes, and I need to know more. No, I don't know enough about it. Or the last choice, I'm unsure.
Okay. I'm not even going to guess, you guys. I'm always wrong. So,
Well, I think let's close the poll and share the results. We want to thank everybody for voting tonight. So we have, as you can see, 78% of you said, yes, I've heard that after 35, there are more risks to a baby. 22% said, yes, and I need to know more.
okay, well, let's talk about it then, because you're right. And you've heard that as women get older, the chance of her having a baby with Down syndrome and other chromosomal conditions is increased, and that is true. So it's understandable to be concerned, because while the risks of these conditions do increase with age, I want to take a moment and put those risks into context, because the overall likelihood of having a pregnancy affected by a serious chromosomal condition such as Down syndrome is still quite low regardless of age. So I put up this chart for you, and as you can see, the woman's age is on the left side, and at the top you see the risks of having a pregnancy with Down syndrome, and as you continue to look over to the right, you see the risks of all other chromosomal abnormalities combined. So let's look at this together. So when a mom is 25, the chance of her having a pregnancy with Down syndrome is about 1 in 1,250. And if you follow the chart across the top, the risk of all anomalies is 1 in 476. Well, that's pretty low, right? So it's about 1 in 1,000 for Down syndrome and about 2 in 1,000 for all abnormalities. Now, as you look at the risks at age 35, you'll see that the likelihood of having a pregnancy with Down syndrome is now increased, right? It's 1 in 378. Now, at first that might seem like a big increase in risk, and it is, but the overall risk is still less than 1%. And another way to think about it is that at age 35, if you take a large group of women, let's say 378 of them who are all pregnant, only 1 in 378 will have a baby who's affected by Down syndrome. So remember, it's still less than 1% at age 35. At age 40, the risk goes about to 1 in 106. That's still about a 1% risk. So you may be wondering about whether a man's age is a factor, and what I can tell you is that more studies are needed, because fathers over the age of 40 may have a very, very slight influence on the risks of miscarriage and other conditions. But again, if you have concerns, do talk to a genetic counselor. Now, how do we test for these chromosomal conditions? In the past, we only had what are called invasive tests, such as amniocentesis and chorionic villi sampling. And both of these had very slight risks of miscarriage. But in the last few years, things have changed, and now we use a very simple blood test, which have absolutely no risk of miscarriage and can screen a mom and her baby as early as 10 weeks for these serious chromosomal conditions. These tests are known as NIPT, and it stands for non-invasive prenatal testing. The term non-invasive means there is absolutely no risk of miscarriage because only the pregnant mom's blood is tested. These are very sensitive blood tests that can detect the baby's cell-free DNA that is circulating in the mom's blood. I mean, how cool is that? And virtually all of my pregnant patients have access to and decide to use NIPT because it can be done very early in the first trimester. I know this is a lot of complicated information, and this might bring up even more questions. Remember, there's a resource guide that we're going to send you after the webinar. And as always, if you have more specific questions, you can type them in the chat box and we'll try to answer them tonight. But do seek out your OB/GYN provider or a genetic counselor. I'm going to talk a little bit more now about genetic carrier testing. And we're going to talk about some of the other testing you might consider prior to becoming pregnant. And this can be a little bit complicated, but I'll do my very best to help you understand. So there are conditions and diseases that only occur when a person has 2 copies of a defective gene. People with only 1 copy are said to be carriers of the disease, and they don't show any signs or symptoms. And you may have heard of some of these recessive disorders. These are called silent disorders or recessive disorders because the person carries 1 copy of the gene and they have no signs or symptoms. It's only when they attempt to get pregnant with someone else who has 1 copy of the gene is there a risk to the child. And these are some of the names of these conditions: cystic fibrosis, spinal muscular atrophy, also known as SMA, sickle cell disease, or Tay-Sachs. These are just a few of the over 250 different inherited conditions that we can now test for. So just to recap, using a simple blood test, parents can be tested for over 250 different recessive silent inherited conditions prior to becoming pregnant. Remember, for these conditions, there's only a 1 in 4 chance of having an affected child. So even if you have already had a child and you have not had any genetic issues with that child, but you didn't have any testing, I still recommend, and it's still recommended, that you consider testing. Many of these conditions are very rare, but if they're not found out, they can lead to very serious consequences. So I want to talk to you about how these recessive disorders are passed on. This is a chart that shows you how a silent carrier, that is, again, people with no signs or symptoms of a serious condition, can unknowingly pass on a problematic genetic mutation to their offspring. Remember, people have 2 copies of each gene, and in this chart, each of the parents has 1 normal gene and 1 problematic genetic mutation. And as you can see, each parent will give 1 of their genes, either the normal gene or the problematic gene, to a child. And so this is basic chance. On the bottom left, you see that the child inherited both copies of the affected gene. So the bottom right is the child who inherited both copies of the problematic gene. So that child would be affected, but none of the other children would be. That means that only when both parents are carriers is there a 1 in 4 chance of having an affected baby. That means that 3 out of 4 of their children, the chances they will not be affected. 2 will be carriers and 1 will have none of the problematic genes. So while we're on the topic of tests in pregnancy, let's talk about some of the other standard tests that we do once a couple becomes pregnant. There are some optional tests and some are just standard. These tests help your OB provider determine how healthy you are and whether there are going to be any concerns for your baby. So in the first trimester, you'll be asked to have several blood tests. The prenatal blood test tests for anemia with what's called a complete blood count, or a CBC. We'll test your blood type and whether your blood could contain any antibodies that could possibly harm the pregnancy. We'll also check your blood group and your RH or rhesus status. It's important to know what blood group and type you have, and this is determined by 2 factors. So there's number 1, there's a blood group that's O, A, B, or AB. And then number 2 is the RH or rhesus status. It's either positive or negative. Now, when a woman is RH negative and the baby's dad is RH positive, we use something called RhoGAM injections to prevent her body from forming antibodies that could harm this or future babies. Let's talk about some other standard tests in pregnancy. We do a lot of screening for diabetes. You may be tested in the first trimester and again in the second trimester, depending upon your risk factors. To screen for diabetes, your OB provider may order something called a hemoglobin A1C test, a fasting blood sugar, or they might ask you to drink a glucose solution and then check your blood sugar 1 hour later. You may be tested for hepatitis B. Again, you may be tested for your rubella, your varicella, your measles immunity. You'll be tested for syphilis, HIV, bladder infections. You may also be tested for toxoplasmosis, gonorrhea, chlamydia, and TB. We also do pap smears. Pap smears test the cervix for precancerous and cancerous cells. This test is often combined with a test for the presence of high-risk HPV or human papillomavirus. It's perfectly safe for a woman to have a pap smear in pregnancy. And if she has an abnormal pap or high-risk HPV, she may need further testing. So I want to find out if any of you have any concerns about hepatitis B. So we're going to launch another poll.
Actually, what we're going to do is have you just put it in chat. Are you concerned about whether or not you have an hepatitis B? Say, yes, there are people in my family, or yes, I've tested positive, or no, I don't have hepatitis, or no, I'm not concerned about it.
Oh, okay. I think we have updated our slides so often that we had a poll here. So let us know in the chat box if you have any concerns about hepatitis B. And we'll just wait and see if anybody's saying they do.
So far, it's been no, we don't have hepatitis B, or no, they're not concerned.
Okay.
So it seems pretty split.
So let's talk about hepatitis B first. So here in the Bay Area, we have a lot of people who come from other parts of the world, specifically Asia, South Asia, and India. Many women who have moved here from Asia or whose family has moved here from Asia, if they are first generation, they may be more likely to carry hepatitis B and pass it on to their baby. Hepatitis B is a very serious infection of the liver, and it's very important to remember that being tested for hepatitis B is a very important aspect of your pregnancy care. Let's talk about diabetes. Diabetes is a very common condition for people anywhere in the world, but especially in people who are coming from Asia, South Asia, and India, and it can be related to genetic influences and dietary choices. So even if you're second or third generation from some of these parts of the world, you may carry the genetic predisposition toward diabetes. So women from these areas or whose families are from those areas are much more likely to be pre-diabetic or even have diabetes prior to becoming pregnant. So the take-home message is, if you've been told that you're pre-diabetic or we're watching you to help prevent you from developing diabetes, it's really important for you to go back and look at our first webinar to learn more about nutrition and how to optimize your health. It's also important for you to see your healthcare provider so that you can talk about diet, exercise, and perhaps medications that can help get your blood glucose under control. Everybody wants to know about ultrasounds, and I'll tell you, this is one of my favorite parts of my job. One of the things I do in my office is when someone comes in for their very first visit is we do an ultrasound to determine if there is a viable, healthy pregnancy. So we call this the first trimester ultrasound, and this looks for a beating heart, and it measures the baby's crown, rump, length. That means from the top of the head to their bottom, not their feet, because their feet are usually drawn up like in the fetal position. And we use the crown rump length to determine how far along the pregnancy is, and we use that to establish an accurate due date. In the first 12 weeks, it's very possible that we will not be able to see anything with a regular ultrasound. We might have to use a vaginal probe. And you know what? I know it sounds scary, but it's perfectly safe and it's painless. In addition to measuring the size of the growing baby and to make sure the heart's beating, this ultrasound can also be used to measure the neck fold thickness. So that's neck, like your neck, you know, where it holds up your head. We look at the neck fold thickness. It's known as nuchal translucency, which provides information about the likelihood of whether there's a higher risk of Down syndrome. A first trimester ultrasound is also used to determine if the baby has a beating heart, if the pregnancy is implanted in the tubes. That's known as a tubal or ectopic pregnancy. Now, if there's no heartbeat, that indicates a miscarriage. A woman may or may not have symptoms such as bleeding, cramping, or pain with an ectopic pregnancy or miscarriage. Unfortunately, about 1 in 5 pregnancies will end in a miscarriage. This can be devastating, and it may take a while to recover both physically and emotionally. Miscarriage is very, very common. Many women have had 1 or more miscarriages, and everyone grieves in their own way. However, it's generally recommended that you give yourself a few months to heal both physically and emotionally. And if you've experienced a miscarriage, please do take care of yourself and take the time you need to heal. And I want to reassure you that 1 miscarriage does not increase the risk of more happening in the future. But if you've had more than 2 miscarriages, do speak to an OBGYN and/or fertility specialist about further evaluation and treatment options. So what about ultrasounds in the second trimester? You can see this lady is really, really happy, and that's because the second trimester is kind of the fun part of pregnancy. That's the time when women have a glow. They're eating more, they have less nausea, they have a lot more energy. Now, in the second trimester in pregnancies, most OBGYNs around the world ask women to have what's known as a level 2 ultrasound. And this looks at the baby's growth and development from head to toe. So not only can this ultrasound determine the baby's sex, but it looks at everything from the 4 chambers of the heart, the stomach, the spinal column, the arms, the legs. We can count fingers and toes. We take measurements of everything. We look at the kidneys, the bladder. We look at the placental placement. We look at amount of fluid. And this ultrasound provides a lot of reassurance. But, you know, nothing is 100%. And that means that we do all these tests and we try to get the most information we can to determine if there's a healthy baby. But we can never guarantee, no matter what the tests come out as, that there will be 100% chance of a completely normal, healthy baby. We just do the best we can to eliminate any worry for the parents. So let's talk a little bit about what El Camino Hospital can offer to you, to moms, dads, and extended families. Well, they offer a lot of things. This is where I delivered my baby, and I hope you'll consider El Camino Hospital for your family too. So after this webinar, we're going to send you a resource guide that includes information about choosing an OB provider. And you know, one of the nice things about El Camino is that we are very open to you delivering with a midwife. And we love having doulas here with moms who are laboring, and as well as other community resources. You can use the search tool on El Camino's website to find a doctor where you can find someone who's culturally appropriate, someone who speaks your language, or someone you just connect with. You can also gain access to our Health Library Resource Center, and this is super helpful if you have any specific health conditions and you need more information or a special diet. In addition, El Camino offers many culturally appropriate programs and services related to specific health concerns, let's say diabetes or hepatitis B, and heart disease for people from various parts of the world who may be at higher risk. We also have a South Asian Heart Center and a Chinese Health Initiative. We have on-site translation services for family and patients, and we have a variety of yummy foods from all over the world. We have a chef here who does an amazing job with the food. I mean, it's not the hospital food that you may have heard about. But you know, a lot of our patients bring food from home, and we welcome that. We also have all kinds of support classes offered not only throughout your pregnancy, but as you become parents. There's childbirth preparation, new parenting classes, breastfeeding classes, infant and child CPR. There's also new moms groups for afterwards. And every single mom who delivers here at El Camino will be visited by a lactation consultant. We have a lactation center that has not only help with, on an appointment basis, but also drop-in help. And there's a really cool lactation store that has everything from nursing bras to nipple shields to pumps, you name it, they have it. And I guess finally, we all think about privacy when we're welcoming a new baby into our life, and especially after delivery. It's nice to know that there are private delivery rooms with comfortable fold-out beds for partners and family members. And I mean, they really are comfortable beds. So we have covered so much tonight, from how to talk to your partner about sex, family history, inherited conditions, chromosomal abnormalities, and testing options. Again, after this webinar, you're going to be sent a link with more resources. So I'm so glad that you joined us tonight. There is an evaluation form, and we love your feedback because we do use it to develop more content for the future. In fact, this webinar was, we did this webinar last year. It was, all this content was in 3 episodes, but people wanted even more information, so we made it 4. I hope you'll join us for our next webinar. It will be on Tuesday, May 28th at 7 p.m. And the title is, "You're pregnant, congratulations." Oh my gosh, now what? Because I know you're gonna have a lot of questions. So thanks again for joining. Sharon's gonna wrap us up, and I'm gonna stick around. We're gonna answer your questions.
So great. I just want to remind everybody that we have put the personal assessment and the resource guide in today's dashboard as handouts. All you need to do is go download them. So if you want to read them or take advantage of them now, you can do that. Otherwise, we'll send you the links.
Where are those on the dashboard? Where do they have to click?
It says handouts.
Oh, okay.
And everything is right there.
Oh my gosh. And also, I see it in my chat box too. Is
Yes.
that, so do we have lots of ways for people to find this?
Yes, we do.
Oh, cool. All right.
We have one question let me share with you. I was 16 and 17 years old when I got pregnant with my son and daughter. I'm now 35, remarried, and we want to try for a baby, but I'm so nervous I will have problems conceiving because of my age or have a miscarriage.
Well, congratulations. And that means that you have a teenager at home. I can understand why you would be nervous, but I want to reassure you that 35 is not too old, and you have a very high likelihood of getting pregnant within the first 6 months of trying. And how do I know that? Because you have proven fertility. You were able to get pregnant in the past. Now, when it comes to issues in your pregnancy, unless you have a medical condition, unless someone has told you you're high risk, then you should consider yourself as a normal patient. But again, if you have concerns, do see an OB provider for a preconception visit. And I want to wish you the best of luck, but don't let fear prevent you from trying to get pregnant with a very wanted child. I mean, I'm going to tell you something. I had my first baby at 37 and he was perfectly normal. Of course, I was nervous and I had all the testing. He just graduated from college and speaks 2 languages. So I think he did okay.
Absolutely. So is there a genetic test for autism?
This is a great question. At this point, we do not have any genetic tests for autism. There have been 6 to 7 genes identified, and a lot of that work took place right up the road at Stanford. But at this point, we cannot test babies prenatally for autism.
This is embarrassing, but it hurts when we have sex. What should we do?
So if you are having pain with intercourse, the first thing I'd like you to do is try a lubricant. And if you're already trying a lubricant, then do see an OB/GYN provider who has experience in this area. Sometimes it's a pretty simple fix. Sometimes the issues are that we can help with in 1 or maybe 2 visits, but you'll probably want to see someone if the lubricants don't help.
So here's something we have just at the wedding. We often get the question is when we're going to get pregnant, but we're not really ready. So what should we do?
So it sounds like your family's pressuring you to get pregnant. And you're not really ready. What should you do? So maybe you're asking how to talk to your family. I think the first thing is to make sure you're communicating with your partner and making sure you're both on the same page. I think it's also important to communicate about the pressure you might be feeling from your family members, and then think about how to talk to one another about presenting a united front to the in-laws or to the potential grandparents. I think it's a lot easier when both people in the couple are on the same page and they're both saying the same thing to their family members. If you're not ready, you're not ready. Take the time you need, because becoming a parent is it's a lifetime commitment. Don't feel guilty about it. I think here and in many areas, there's all the compare and despair, and people think, okay, well, we got married, we bought a house, we have this certain type of car, we have a certain type of lifestyle, we should have a baby. But everyone is different, and there's no one right or wrong way to do this.
I live far away from the Bay Area and would like to have an OB/GYN 4 hours. Is it feasible to have an OB/GYN 4 hours away from where you live?
I have many patients who live far away. In fact, I have patients who live in Hong Kong. I have patients who live in Austria, who live in London, who visit me for their gynecologic care. But it is not reasonable to see a prenatal provider who lives 4 hours, that you live 4 hours away from. Because when you go into labor, you're going to want to be close to a hospital. But you could certainly see someone around here to help you get pregnant. And then we can sometimes provide good referrals to other providers in your area.
We have another question. I got a positive test a few weeks ago, and I was so excited to see a doctor to get tips and more information. But they told me that I have to wait 8 weeks to get my first appointment with my new obstetrician. Is this normal, or should I try and get an appointment as soon as possible?
Well, that happened in my office the other day. Different providers have different rules about when they'll see you. So some providers, like in my practice at El Camino Women's Medical Group, if someone has a lot of questions, we have them come in and we do a visit right then and there. We can't do the ultrasound because it's too early, but we can go over all the questions and answers with you. It is kind of the standard of care. If you want more information about all the do's and don'ts, you can go to my website, nursebarb.com. I have a pregnancy guide there, and there's a lot of information. So I would encourage you to find a provider that fits with what you need.
My husband and I have been married for a year and we can't have intercourse. Should we go to IVF to get pregnant?
Oh, okay, so you've been married for a year, but you can't have intercourse, and you're thinking about, well, what's the best way to get pregnant? And it might be in vitro fertilization. I would say go see an OBGYN provider first who has experience treating couples where there's painful sex or vaginismus, because it will be a lot less expensive. And if you're unable to have penetrative intercourse, there's a lot of different procedures that have to be done with IVF where it will be uncomfortable for you if we don't treat your vaginismus. Also, your sexual health is such an important part of your overall health, and your sexuality and your intimacy is an important part of your relationship. If you're not connecting sexually, it is something that we can help you with. And you know, it's such an important part of your overall satisfaction in your marriage. So don't let embarrassment prevent you from getting the treatment you need.
We have another question. My husband's penis bends to the side and we can't get it into my body. Is there something we should be doing?
Well, I'm glad you asked this question. So there's a condition known as Peyronie's disease where a man's penis does have a bend or an angle. There is a lot that can be done to help this. You're going to need to see a urologist, and that's a specialist in men's health. In fact, we have a webinar on, June 13th, where I'll be interviewing Dr. Edward Cartman about men's health, and we're going to be talking about different things that men can do when they have issues with their sexuality. But for this type of issue, do see a urologist. It's a lot more common than you might think. You're not alone.
I had a miscarriage about 6 months ago. Is it safe for me to try again?
Oh, I'm really sorry. I'm really sorry that you experienced a miscarriage. Can be very, very devastating. As long as your healthcare provider has cleared you and said that you can go ahead, then I see no reason why. If you're emotionally ready to try to get pregnant, good luck. I hope it happens for you.
I had chicken pox as a kid. Does that mean I'm immune?
If you had chicken pox as a child, the likelihood is very, very high that you're immune, but we still want to test you. Sometimes people think they had chicken pox and maybe it was measles or something else, so you'll be tested. But the likelihood is that you are immune to chicken pox.
So a similar line of questions. I'm worried about the measles epidemic. How can I know if I need to be vaccinated?
Well, if you are worried about the measles epidemic, do ask your provider to do what's called a rubeola or a measles titer. You don't have to remember rubeola, but the measles titer, I'm ordering it like 3 times a day now at my practice because so many people are very understandably concerned.
We have another question here. Why was microsort, and they're clarifying separating male and female sperm, allowed and then banned in the US?
So let me read this question.
Why was microsort allowed and then banned in the USA?
Oh, yeah, I can't speak to that that ruling, but I know that a lot of providers do help families conceive a baby with the sex that they want. And there's a lot of information online. In fact, I even publish information on my website, nursebarb.com, about how to increase your likelihood of having a baby with a certain sex. But I can't speak to why it was banned.
Well, we're kind of at the top of our hour, so we want to thank everyone for all the questions. Oh, wait, we have one more question. If I miss my period for the first month, what's the best method to check if I'm pregnant?
So that's a good question. The best method for you is to go to any drugstore and buy one of those home pregnancy tests, because they're just as accurate as the tests that we use in any hospital or clinic. Well, thank you very much, everyone, for great questions.
Yeah, thank you. This was great. You guys were a very attentive and wonderful audience. We want to thank you for coming, and we hope to see you at our next webinar.
And don't forget to do your evaluation.
Yes, we always like to hear. Thank you. Have a good night, everyone.
Bye-bye.